Hi there, I'm Dr. Stephanie Falk, and today I want to talk about anxiety. What is anxiety and how is it different than stress? Anxiety is a clinical diagnosis. It's actually referred to as generalized anxiety, where people tend to worry about a number of different things. There's not usually a theme to it. At times there can be, but inherent in the definition is that there are a bunch of things that someone worries about, and that worry is greater than what other people would experience, and that worry is very difficult to rein in. So how is that different than stress? I think stress is a natural response, and the response that someone has to a stressor in life is very consistent with what's right in front of them. So for instance, you get rear-ended and you're driving your car. That's a stressful situation, and the stress that you exude should match that stressor for the most part. Someone with a clinical diagnosis of generalized anxiety, the likelihood that they would respond in that situation in a lot bigger way is usually what takes place, or they're likely to do that. They're also likely to worry about, like I said, a number of different items at once, and it's really difficult to stop their mind from racing around those things that they're worried about. About 18 million people in the US live with anxiety. It is the number one most diagnosed issue related to mental health. And unfortunately, only about 37% of those individuals seek any kind of help for anxiety. So if you're not able to get in with a therapist right away, or if that doesn't seem like the right approach for you, and you initially want to try some things on your own, a couple of things that you could try to help manage anxiety would be to address what some of your triggers tend to be. And this I think works for people that meet criteria for generalized anxiety, and those that are dealing with just a lot of stress or stress pileup. I think it's really important to be able to understand what are the things that are most likely to set me off, and how can I prepare for those things? How can I watch out for those things? So for instance, if something that sets you off is traffic on the freeway and the busy hour, and you get super nervous on the road, then maybe you decide to take side roads, or maybe you decide to travel at a different time. And so you utilize preventative factors that help you mitigate some of the anxiety that you could experience on the road. So that's just an example of why it's important to identify triggers and things that can, in other words, elicit a little bit more anxiety from you and call that forth in a way that doesn't feel good. Living with anxiety doesn't feel good. So identifying your triggers would be a good first step if you're going to, like I said, try to handle it on your own. Secondly, it would be to try to figure out what are my go-to coping skills that are tried and tested, that tend to work for me, and how can I implement those when I'm experiencing some anxiety. For some people, it might be a physical intervention like jumping jacks, taking a walk, taking deep breaths, stretching. For other people, it might be a cognitive thing where they reconsider their thought process. So for instance, maybe you get rear-ended on the road, and the first thing that you think of is, oh no, like my car's totaled. Might be a thought that's catastrophizing, rather than a thought that says, okay, like I need to get out of the car and assess the situation. I'm just trying to paint a picture for how we can toy with our thoughts a little bit and make sure that we're really assessing the situation before we jump forward into the future, or we make a problem bigger than it is. So that would be looking at your thoughts and trying to revamp them a little bit. Other interventions might include leaning on people for support, knowing what brings you an instant calm. Maybe it's a song, maybe it's a poem that you recite, maybe it's words that a loved one has said to you before, maybe it's an image of the beach that you love to frequent. So figure out your triggers, figure out some common coping skills, and try those for a couple of weeks. And if you're having some trouble, then I think that might be a time to consider meeting with someone, or at least talking to a friend or a loved one that you trust, and like I said, perhaps seeking professional help. Again, I know I've said this before, but if thoughts ever lend themselves towards suicide or self-harm, I think that that's the time when you instantly try to seek some support and help for that. I hope it's been helpful to tune in. I hope that you've gleaned just a little bit more about how to manage anxiety. I hope this finds you having an absolutely beautiful day. Thank you.